So thanks for the opportunity and the time to talk about this. I know that we've been talking about system of care for a couple of years now, and we, as a partner with the collaborative, have been working in concert around our work related to system of care. So I unfortunately didn't have enough time to engage other partners in this work, in this presentation. So I might, if like, I know Assad's here and Mark's here and other folks, if you have things to add, just feel free to jump in and add your thoughts. This isn't like the Cindy show. It's just because it really takes a team to do this work. So could you move this next slide, please? So for those of you who've been around a while, this is probably not a new graphic. What this slide shows us is the core values or framework behind system of care work. And as you notice, in the middle is the big part, which is youth and parent driven. And you know, and I've said this to people before, the more and more I do this work, I really realize what that means. And it's not just parent and youth driven, isn't just about having focus groups and bringing parents to the table. It's really where you embed in your service model that you're organizing around the needs of families. And that is a really huge paradigm shift to make. And it can be challenging in a system that we currently have that's really geared toward what are you, rather than asking parents, what do you need? We usually, or the youth, we usually say, what's your diagnosis and what are you eligible for? And the conversation's very different when you approach it from the need-focused discussion. The other little circles around the youth and family are really the other pieces that are really important for to really have an operating system of care. And it's all these concepts need to be part of the direct service that's delivered to address youth and families' needs, but it also needs to be part of the systemic and level work that's being done as well. So I know some of these are kind of jargony kind of concepts and things that are the latest words like trauma informed and data informed. But when you truly embrace these and embed in your system, you think and interact with each other in a very different way. So I just want to keep reinforcing these core principles. Next slide, please. And then in Hennepin County, as we've done this work, these three pillars are the service system pillars that we organize our system change effort around. And some of you we've been working with Liz Manley, who is a technical consultant out of the University of Maryland, who works with SAMHSA to help communities across the country build their children's mental health systems around system of care frameworks. And as we've done this work, and some of you were able to meet Liz a couple of years ago when she was physically here, but these are the three core services that really are important to have operating to help make the change, both in the way the services are delivered and the way the system is organized. And the first one is family response and stabilization, which is a two-component service that responds to families at the time that they are experiencing a sense of urgency or stress in responding to the mental health or behavioral needs of their child. And this particular service, as I said, has two components. The family response component, which involves a family calling a dedicated line and saying that they need help, and somebody physically comes out to meet with that family within the hour of the phone call. And during that time, and for the next 72 hours, that person stays connected with the family and helping them, first of all, de-escalate whatever got that parent to the point where they just felt like they couldn't respond any longer, help the youth de-escalate if their behavior is part of the is part of the issue, and then work with the family to really identify what are their immediate needs and to develop an immediate safety plan with them. If it's in that 72 hours, some families are going to be able to be okay and have an ongoing support plan that they feel they can move forward with on their own. If they don't feel like they can do it, or they need additional time to discern what their needs are, then they can be referred to the second component, which is called family stabilization. So, and in that is an 8-week service response that's somewhat of a continuation of the work that started during the family response component, but builds on that and tries to help families look at how they can develop their, and empower them to be able to develop their own support plan. One of the things I want to say about both family stabilization and wraparound, the next core service, is that these services are really not just like traditional case management, where a family is a case manager helps a family navigate the children's mental health system and helps them coordinate and connect to the right types of clinical services. In both family stabilization and in wraparound, the approach is to help the family expand their thinking about who can be helpful. Some of the who can be helpful can be extended family members or other natural supports. It can also be informal supports that include folks like neighbors or people from whatever spiritual group they might be affiliated with, as well as professional services. So that family stabilization component can continue to work with the family for up to 8 weeks. The middle component, wraparound, is a more intensive care coordination service model. Agencies like Susie's agency, FamilyWise, has been delivering wraparound for many years now. But what we're doing with it as far as our system of care work is really using the service model of wraparound to work with families as we're trying to help them navigate their system, the system to meet the needs of their child. And then the other component is a continuum of services. And I know when we first started working on wraparound and when we first started talking about system of care, people often think of the service continuum as a system of care. It is part of a system of care. And it includes everything from prevention and early identification to deep end services. And really looking at what are all the service needs in formal service needs of families and young people, and making sure we know that we have adequate capacity as well as adequate types and service models to meet the needs of youth and families within the guiding principles of a system of care. Next slide, please. So when we talk about system of care, obviously funding is also a component of building a system. And on the left, we have what our current funding streams. DHS had a statewide system of care grant, and we used that grant to pilot and expand wraparound. We had grants from UCare and Blue Cross Blue Shield that are health plans that have reinvestment grants. We used those grants to pilot the initial stages of family response. And Hennepin County has also dedicated property tax funds toward developing those service pillars. As we're moving into 2022, and we'll talk more about some of this as I go through some of these, but Hennepin County had gotten significant funding from the American Recovery Plan, or ARP, and has identified behavioral health and children's mental health as a priority for those funds. And we're using some of those funds to expand some aspects of our system of care work and to continue to build other parts of the service pillars. We're continuing to get some DHS statewide grant dollars, but those will end by the end of, by June 30th of this year. I think that's when it's ending. Once again, property tax investments continue to be a part of the funding stream. And as we expand the high fidelity wraparound, we're looking at doing billing under case management for that component. Next slide, please. So just to build a little bit about what we're doing with the ARP funding, and we've been talking about some of this, so people probably have heard of it. We recently did a request for applications to expand school mental health. And over the next 2 years, we will be using $2.5 million of ARPA funds for that expansion. We're also working at expanding work with culturally specific mental health providers. And this isn't just with children, it also includes adult work. And there's funding dedicated for that. There's also funding in the behavioral health parts of the ARPA funding to do work in the infant and early childhood mental health area. And so we're partnering with Angela and Meredith around that work as well, which includes $2 million toward home visiting programs to support families when they first start having struggles with their young child, and also $2 million toward a program called Caring Connection for Kids, which is a program where public health nurses go out and do developmental and children's mental health screenings of children involved in the child protection system. And we started doing that with children under 5 and out of home placement. And this funding allows us to expand both the age range as well as including young children who aren't involved in the child protection system, but still living in their family home. There's also $1 million dedicated to juvenile justice and behavioral health initiatives that are just starting to be developed. So that's a new part of the work that we will be embracing. And then we've also dedicated 1.5 million toward continued expansion of family response and stabilization. Next slide. And the other thing we're working on, many of you knew last year we tried to, or we did submit a SAMHSA System of Care grant. We were not funded last year, but we're going to try again this year, and we're learning from the feedback we got from our grant last year. We're going to continue to focus that application on the building out of family response and stabilization. And within that, we're also building in capacity to do parent and youth engagement. And so those are the two key components that we're building into that grant application. Next slide. So I just wanted, and we shared this with other groups, from Hennepin County Human Services in children's mental health. These are our 6 strategic priorities. And I'll just kind of briefly give you a background on each one of these. Next slide, please. So we did launch Family Response in August of last year. So we have almost 6 months of service. And as I already explained, Family Response includes 2 components. And the first component is what we've been piloting. And we work with a partner with a community agency, FACTS, to do the family response work. What we're going to be doing over the course of this year is build in more capacity in family response, as well as build in capacity to do the stabilization component. Specifically, right now, we have a request for proposals for culturally specific agencies to partner with us around the stabilization service. So we're, as I said, leveraging the ARP funds to do the expansion, and these are the culturally specific or the cultural communities that we're targeting for the family stabilization service. I also want to say that we made this decision to do this stabilization with a culturally specific lens, based on the feedback we got in doing focus groups and surveys with families who said they needed somebody who looked like them to respond when they're feeling like they're in crisis. So we do have capacity also for people who don't belong to these cultural groups, but we wanted to be specific in addressing that need in our community. So the other thing that we're building on is the pilot that both FamilyWise and VOA have been a part of in delivering high fidelity wraparound for the last couple of, well, it's probably been 3 or 4 years now. But like I said, FamilyWise has been doing wraparound probably for about 7 or 8 years. So we're adding capacity within our contracts. The other thing that we did is we hired 3 additional case managers at our Hennepin County staff, and we're converting 2 existing case managers to be wraparound service coordinators. And what we're trying to do is use the wraparound service model as a way to do case management or care coordination so that we can bill MA fee for service for that work, as well as the PMAPs, which are the prepaid medical assistance programs. And within our service capacity, I talked about, one of the things that we've been doing is to expand school mental health, and our goal is to have a community agency in every mainstream public school and intermediate district school to be able to provide direct mental health services and the ancillary component into every school, as I stated. So we just finished our RFA process, and if we're able to, we believe we will have succeeded in meeting that goal once we are able to contract with those agencies. And as I said, we're also working with Meredith and Angela and other folks to expand our capacity to respond to the early developmental and mental health needs of infant and preschool children. And I've already talked about these three. The other really big piece of building a system of care is around outreach and engagement. And that, we talk a lot about parent and youth engagement, but we also are working at building our capacity to engage key community stakeholders and partners, and are doing intentional outreach and engagement with culturally specific providers. And Assad is, we hired Assad, and he's our lead person at Hennepin County doing this work. Jocelyn continues from Hennepin County, works with us in doing this work. And we're also continue to engage with PCLG and building in other ways to really use the platform of the collaborative to do this engagement work. And I think that's all, folks.